Greetings everyone. I'm thankful to the organizing committee of Second International Brain and Biomedicine Conference 2024 for granting me a chance to present my work at this platform. I'm Hasnain Zafar, an MPhil scholar from Institute of Zoology, Bahauddin Zakria University, Multan, Pakistan. The upcoming illustration is entitled as The Prevalence of Diabetes Mellitus and Chronic Complications of the Diabetes Mellitus in the District Buner, Khyber Pakhtunkhwa, Pakistan. Diabetes mellitus is recognized as the most common endocrine disorder globally. It affects over 100 million individuals, accounting for approximately 6% of world's population. This metabolic condition is characterized by either a deficiency or the ineffectiveness in the insulin production by the pancreas. It leads to the fluctuation in the blood glucose level. These alterations can cause significant damage to various body systems, notably affecting the blood vessels, eyes, kidneys, heart, and nerves. Diabetes mellitus stands out as a critical public health issue worldwide, primarily due to its chronic nature and the way it disrupts the carbohydrate metabolism. It leads to the persistently elevated blood glucose level. The Buner district of Khyber Pakhtunkhwa, Pakistan presents a unique demographic and geographical setting for studying the prevalence and chronic complications of diabetes mellitus. The project began with the objective of assessing the prevalence of diabetes mellitus and its chronic complications in the Buner district, Khyber Pakhtunkhwa, Pakistan, and to understand the demographic distribution of this disease. To achieve this feat, a comprehensive area-specific study was conducted from March 2022 to August 2022. It involved 753 patients across 8 localities in the Buner district. The data was collected using questionnaire, interviews, and observation at various medical centers. The questionnaires comprised a series of questions pertaining to diabetes and its chronic complications. The data collection occurred across various Union Council and the hospitals in the district Buner, including Buner Medical Complex, DHQ Dagar, and Buner Medical Center, Dagar Buner. The data encompassed a wide range of risk factors such as age, gender, family history, and dietary habits. The participants included individuals from both rural and urban areas, with the demographic split of 486 males and 286 females. The study also investigated 6 types of chronic complications associated with the diabetes mellitus. Data analysis was performed using the Microsoft Excel and SPSS version 25. This study found that the prevalence of diabetes mellitus in the Buner district was significantly high, the higher incidence in the urban areas compared to the rural ones. The prevalence of the chronic complications of diabetes mellitus varied, with the cardiovascular condition being the most prominent, followed by the neuropathy, then nephropathy, ocular condition, and foot diseases on the lowest one. If we look at these graphs, first one is about gender distribution. You can see that in male, the number of counts were higher than the females. If we look at the age distribution, sorry, the age group of 30 to 50 years had a higher number of counts, followed by the 50 to 70 years, and then 10 to 30 years. Though the number of the count in this group is lower, but it is the most chronic one. Diabetes prevalence by area. We can see that the rural areas had just 33% of counts, or you can say the sample or positive ones, and the urban area had 67%, which is the higher. If we look this number of samples according to localities, we can see that the Jowar locality has 153 number, then 114 from the Tarwasak, Barclay with the 97, 86 from the Nagre, Malka had 79, 44 from Chagazi, Pir Baba had the 107 samples, 73 from the Changle. And total number of samples were 753, and total localities were 8. Month-wise reported prevalence of diabetes mellitus, if you can see that April 28% prevalence, which were the higher one, followed by the May, which had 23%, June had 21, March had 15, July had 7%, and August with the lowest, which is 6%. Comparatively, the World Health Organization had a report that an increase in diabetes mellitus in the developing countries, with the current prevalence of type 2 diabetes mellitus in the Pakistan being 11.77%, 11.20% in the males, and 9.19% in the females. The prevalence of chronic diabetes complications in the Pakistan range from 8.1% to 41.5% for retinopathy, 21% to 22% for albuminuria, 6.7 to 46.3% for nephropathy, and 21.9 to 60% for neuropathy. However, our study identified 6 different types of the chronic complications, with the cardiovascular conditions being more prominent and foot diseases showing the lowest range. This study highlights a high prevalence of diabetes mellitus and its chronic complications in the Buner district, with the urban areas showing a higher incidence than the rural ones. The findings underscore the need for the targeted healthcare strategies and the interventions in this region to address the growing burden of diabetes mellitus. Thank you for your attention.